So firstly, I just want to say thank you so much to everybody for being here tonight. I know how tricky it is sometimes to get these evenings off, knowing that we have our little ones at home and they're all tired after a big day at school and kindy. So just thank you so much for everyone for coming tonight. So I thought I'd just start the presentation off just introducing myself. My name is Kate. I'm the owner of Upside Down Therapy. I'm also one of the senior therapists that work there. I am originally from South Africa and completed my Bachelor of Occupational Therapy from the University of KwaZulu-Natal in 2011. I've completed numerous professional development courses in sensory processing, childhood development, feeding, toileting, understanding neurodiversity. So I've done extensive training in all areas of development. And I've worked across the health and special education system in South Africa. And then since immigrating to Australia about 5.5 years ago, I've worked within the private sector providing early intervention services. Besides being an OT and a business owner, I'm also a co-trainer with Sense Up Training, where we provide annual sensory and action workshops across Australia to other healthcare professionals. I'm also a co-owner of Australian therapy equipment business called Sensory U, where we manufacture and sell Australian-made sensory and therapy equipment. And aside from all things work-related, I'm also a mum of 3 beautiful children, which you can see in the image. But most of all, I'm actually just all passionate about early intervention and all things sensory. And I truly believe that collaboration is key. I've worked extensively with multidisciplinary teams and also with working in the schooling environments in South Africa, very closely with working with educators as well. But my biggest goal is actually just to develop confident, resilient, and happy individuals. So regardless of their diagnosis or their challenges, it's really just to ensure that we can develop these confident and resilient little children. So before we start, I thought I'd like to get some information about who you are. So if you wouldn't mind popping into the comment box, if you are a teacher or a therapist or a parent, I'd love to know who you're here representing. Yes, if you could just do that for me, and I'll have a quick look to see where you're from or who you are coming as tonight. Thanks, Glenda. So we have a centre director. That's lovely. I'm so happy that we have some educators and amazing, precious. A mum, good, and thanks, Claire. A parent and a speechy. A mum and a teacher. It's so lovely to have some educators here tonight as well as our beautiful our mums. Thanks, Laura. I've been at a pediatrician clinic. I love that. It's so great to have an understanding of childhood development when you're working within the pediatric clinic as well. So good to know that we have quite a wide range of different people presenting their little ones this evening. So thank you so much for joining. All right, I'd just like to ask, we're going to keep questions to the end, but if you have any sort of pressing questions that you'd like to ask, just pop them into the comment box and I'll be able to review that at the end of the presentation. And if there's anything that you still feel that we hadn't met, or if you feel that you want to get some more information or clarity around a specific little person, you're welcome to request a discovery call, and you can just email me at hello@upsidedown.therapy.com.au, and I'll be more than happy to provide some more information. So with the webinar this evening, we are going to be understanding the basics of sensory processing and how it is important in the development of a child. We'll be recognizing how sensory processing difficulties can impact social and emotional development, because I think this is really important to understand when we see various challenges in emotional and social development. What does this mean? Okay, so what is that underlying factor that could be impacting the child's ability to engage optimally within their environments? And then we'll also be learning a couple of strategies that you can use to support your little one's behavior at home and in the classroom. Okay, so before I start, I wanted to bring up this very complex looking table. But as a bottom-up developmental OT, I use this model or any developmental model, but this one specifically, which is the SenseUp model. This was developed by my friend and colleague, Kate Reeves, from SenseUp Training. And I use this to guide my assessments and intervention with children. So this model emphasizes building strong sensory foundations first, and the sensory foundations are what's in the orange box on the bottom. Recognizing that skills like attention or emotional regulation or motor skills are all reliant on a well-integrated sensory processing system. Okay, so when children are often referred for occupational therapy, it is generally due to challenges with areas in the green. So that's the area right at the top in the top of the triangle. So this could be due to learning challenges, difficulty focusing in class, having difficulty making friends or keeping friends, difficulty with eating. They might have some sleeping challenges or toileting or emotional regulation, big meltdowns. And it is my role as an OT to assess all the levels in the bottom to determine what areas could be impacting the child's functioning. So starting from the very bottom, which is sensory processing. So why does this really matter then? Well, if foundational systems are not functioning effectively, then higher level skills like attention and learning and social participation will be impacted. So we know how important it is having a really good foundation when building a house and when you're trying to ground, your parenting strategies within your children. Using a bottom-up approach, I can develop those interventions that target the underlying sensory processing challenges rather than just addressing the symptoms. So, for example, if a child is referred for toileting, I might go back down and see, are they having toileting issues because they have poor interoception? So they can't actually feel that they need to go to the toilet. Are they having toileting issues perhaps because they have vestibular or balance issues? So going up onto a toilet is quite challenging for them. Do they have difficulty with toileting because they have poor body awareness, which is proprioception? Or do they have difficulty with auditory or hearing? They're very sensitive and therefore they don't want to go to the toilet because it's too loud. When they flush the toilet, it's very scary for them and it's very loud. So it's really important to, instead of jumping and just going into toileting, to look at all those underlying factors. And today we're just going to be covering that orange section, so sensory processing. So let's understand what is sensory processing. So sensory processing is how our brain receives, understands, and responds to information from the world around us, okay? So this is things that we see or things that we hear or things that we touch, but also from inside our bodies. So are we feeling hungry? Are we feeling a little bit of pain? So this information helps us make sense of our environment and it helps us interact with others, but also it helps us learn how to move our bodies and respond in the right way. So, for example, we might use sight and hearing when we want to communicate with others, or we might use touch and body awareness, which is proprioception, when we need to do movement or when we want to have good coordination, for example, playing a sport like soccer or football or rugby. We use interoception to recognize how our body feels inside. So when we're feeling hungry, we know what that feeling feels like. When a child is thirsty, they know that when they get a dry mouth, that means that they need to drink something. Or perhaps if they're feeling anxious, they know that that feeling inside their tummy means that they're feeling anxious. So sensory processing is really important to help us in all different areas of functioning. So let's look at the function of sensory processing. So each system has helps children understand their environment and helps them participate in activities. And they do this through three main functions. Okay, so the first one is safety or to protect us. So for example, we may detect and respond to danger or changes in environment to keep us safe. So if we touch something hot, we may pull our hand away. So that's our tactile sense telling us that something's hot and we need to protect ourselves. We might react to sudden noise or loud noise by closing our ears or moving away from that sound source to protect our hearing. So sensory processing helps us with protection and keeping us safe. It also helps us with regulation. Okay, so helping children manage their energy, manage their emotions, and their attention levels. So, for example, before bedtime, children need to understand how to calm down to go to sleep. Or their sensory systems help us stay alert when we need to play or when we need to learn. The third function is discrimination. So our sensory systems help us in discriminating and interpreting information about sensory processing. So for example, if we're touching something, our tactile sense will tell us that it is soft, that it is rough, that it is hard, that it is wet. So it will help us sort of identify the different qualities of certain information. Same as our visual system. So if we're thinking about kids in the classroom, it might help us identify subtle differences between shapes or between letters, so that we are able to understand when we see those letters that we can actually read it and it makes sense. So beyond the typical belief that we only have 5 senses, so we know our typical senses are vision, auditory, tactile, gustatory, and olfactory. So it's sight, hearing, touch, taste, and smell. We have 3 additional systems, okay? So this is our vestibular sense. So this helps us with balance and motion. Our proprioceptive sense, this helps us with body awareness. And interoception is understanding internal body signals, so hunger and thirst or emotions. So this evening, we're going to go through each section, and we're going to talk about what it might look like if a child has challenges with processing this sensory information. So if we think of sensory processing like a bucket, each of us have a bucket that's inside, and it fills up with sensory information throughout the day. So the amount of sensory information that we need depends on the size of our bucket, okay? So now imagine that some children have a small bucket. Their bucket fills up really, really quickly with sensory information, and this means that even a small amount of noise or a small amount of touch or a small amount of movement might feel overwhelming for them. And they might become more upset, or they might become dysregulated, or they might have a meltdown. So for example, a child that has difficulty with hearing, and there's some noise in the classroom, so might be doing group singing, the child might respond by putting their hands over their ears, or they might hide under the desk, or they might try and run out the classroom. Okay, so you can see that their small cup has filled really quickly with auditory information, auditory sensation, and it has resulted in them wanting to escape, so get away. It was just too overwhelming for them. A child that has a small cup for tactile or for touch, they might have a tag in the back of their shirt, and to them that might feel like a cactus. So to them it might be just too much for them to handle, and they might be quite agitated throughout the day, or they might ask you to please cut the tag out. So for some, we might not notice, and we might be able to just accommodate and understand that that's, you know, we don't even feel that. But with children that have small cups, they notice that sensation a lot easier. On the other hand, we might have some children with big buckets, okay? So their bucket will take a long time to fill, which means they don't react to sensory input as much as what others do. These children would be called under-responsive to sensory information, and they might not notice or respond to sounds. So perhaps the educator or their parent will be calling their name, and they might not respond to sound. They might not respond to movement the same way that others do. So perhaps they are constantly on the go. So not enough movement will actually wake up. They're constantly moving and moving and moving. Some kids might not notice when they're hungry, or if they feel discomfort with certain textures in their clothes. I've had some children that have delayed pain responses, so they might injure themselves without even knowing, or break a bone and they won't even know. So these kids have big buckets, and it takes a long time for them to fill those sensory buckets. If we can understand our child's sensory bucket, we'll be able to help know how to support them. Okay, so if their bucket fills up quickly, we'll find ways that we can help manage that sensory overload for them. If their bucket fills up slowly, we might help them engage in more activities that will help with them coping with their environment and being able to register that information so that they're able to learn and play with others. So if we're looking at sensory processing, when things don't go to plan, okay, it can look like and feel like being stuck in a traffic jam. Okay, so Imagine that the brain is now receiving all the sensory information and is trying to process all that sensory information, but it gets overwhelmed. So just like a car trying to get through a traffic jam, okay, so it gets very overwhelming. The brain will struggle to handle all those incoming signals, and that will lead to a mismatched response to what's actually happening in the environment. So, for example, we might have a child um, they might experience a situation that feels manageable to most people, but to them it's quite overwhelming. So I observed a little boy that was sitting in the classroom on the mats during morning ring, and a little friend would walk past him, and the educator said every time he's on the mat, he tends to fight and hit his friends. So a little friend walked past him, brushed his back, and he turned around and hit the child. Okay, so what we did is we then investigated what could be going on for the child, and it turned out that the child has quite a sensitive tactile system. So every time a child brushed past, it felt like a painful experience for him. Okay, so all we did is we moved the child to the back of the morning ring session, allowed him to enter last so he could choose his spot, a nice quiet area of the morning ring, and he was able to engage with the educator and his peers for that lesson. So sensory processing disorder is what we might call when these things don't go to plan. I'll talk a little bit more about sensory processing disorder versus sensory processing differences in the next slide. But this is when the sensory system doesn't work efficiently, and it makes it really hard for children to engage in everyday activities. So, for example, learning a new motor skill might be difficult for them. So, for example, holding a pencil could be tricky. If they don't have a very good tactile sense to be able to feel the pencil, or good proprioceptive sense to understand where their hand is in relation to their body, they might have difficulty with handwriting. Tying shoelaces is another one, or learning to ride a bike. Let's think about social skills. So understanding how to interact with their friends might be tricky, or being able to play in a group will be hard because they might get overwhelmed with noise or get overwhelmed with their friends touching them or bumping into them. Emotional regulation is a really big one. Often our kids have difficulty managing their feelings and particularly in stressful situations. So this can lead to very big emotional reactions and often results in them feeling isolated and not being able to engage with their friends. I've also mentioned the developmental coordination disorder or dyspraxia. So this is when a child has difficulty planning and coordinating movements. We typically find this with kids that have quite significant sensory processing differences, especially when they have difficulty understanding movement, their movement sense, which is vestibular, and body awareness. So you can imagine if you can't understand where your body is in space, and you also have difficulty understanding how your body is moving, you can imagine it's going to look like quite a clumsy child. Okay. But effective sensory processing is foundational to learning motor skills and emotional regulation. So it's really important to understand sensory processing and how it impacts development so that we can help our young children engage efficiently. So let's talk about sensory processing disorder as a word. Sensory processing disorder is not a formal diagnosis in Australia. So it isn't recognized by the medical diagnostics manual, but it is assessed and managed by occupational therapists that specialize in sensory processing. So we often do this by doing observations, we do some questionnaires, we might do some standardized assessments with the child to see what areas are being impacted. But the focus essentially is to help the child manage sensory information so that we can improve their daily functioning. So you know how we spoke about the top of the triangle? So those are the areas of daily function we'll be focusing on, but we will be looking at the foundations of sensory processing to help support that child. And it's actually more common than we think. So we all have a sensory profile. So even as neurotypical or neurodiverse adults ourselves, we all have a sensory profile of some sort. Okay, it's our ability or it's our responsibility to understand sensory processing and how it impacts levels of arousal. So I want you to imagine on a day where you've had a really stressful day at work, lots of work coming in, lots of meetings, you get home after work and your kids are jumping around and screaming and making a big noise. Now, you will feel that you aren't coping in that situation, that noise will be quite tricky for you to handle, or you may just feel touched out. I know often as parents, we get home after a big day and we're just touched out. We just, especially when we're working with young ones, I can imagine what it must feel like for kindergarten and daycare educators as well. So when we are more dysregulated, or when our arousal levels are higher, we have more difficulty processing sensory information as well. And it's the same with our kids. So as adults, we may have learned some coping tools. We may say, well, I just need to step out for a minute. You might put on some music in the background. You may even have a glass of wine. So we've all learned these coping strategies, but for kids, it's really tough, okay, because they haven't yet developed those coping strategies to help them manage that overwhelm that they're feeling. And then we'll find these big emotional outbursts and lots of dysregulation. So it's quite interesting, the statistics, that it says between 15 and 13% of the general population in Australia have sensory processing difficulties. That some sources suggest that at least 1 in 20 children may be affected by sensory processing difficulties, which is actually more common than ADHD. 40 to 60% of children with ADHD also have sensory processing difficulties, and at least 80% of children with autism also have sensory processing difficulties. So you can see that sensory processing differences or difficulties is really prevalent in Australia and across the world. And it's no wonder that we're having a lot of dysregulation in our early intervention centres and at school. So just a couple of risk factors. So children with a family history of sensory processing difficulties, autism, ADHD, or other neurodevelopmental disorders are at higher risk of having sensory processing difficulties. Genetic conditions like Fragile X or Down syndrome also increases the likeliness of sensory processing. Neurodevelopmental disorders. So as I mentioned, there's a large percentage of children with autism have sensory processing as well as ADHD. Children that have experienced premature birth, so those born prematurely with a low birth weight, are at higher risk of also having sensory processing difficulties. And this is because of the immaturity of their brain and their sensory systems at birth. So we know that our sensory systems are developing in utero. So, you know, when a child is floating in that fluid, they're getting a sense of their balance and their motion. When they flip upside down or pushing against the womb, they are developing their proprioceptor systems. When they can see light coming through, they can feel their mum's touch on their tummy. So there's a lot of areas of sensory processing that happens, or the development that happens in utero and continues throughout life. Kids that have experienced trauma or stress early in life can also impact the development of sensory processing. These can affect how a child responds to information and manage their emotional regulation. And then environmental factors. So sometimes overstimulation or limited opportunities for that sensory rich play will also impact sensory processing. And then medical conditions. So we know, children that have cerebral palsy or might have Down syndrome, these can also lead to delays. All right, so how are we going? Can we get a thumbs up or a okay in the comment section? I know this is going to be quite content heavy tonight, and just let me know if I'm going too fast for anybody. Are we all going okay? Oh, thank you. Got a good thumbs up there. Thanks, Indira. All right, and just remember, if you feel free to pop comments, thanks, Radha. Feel free to pop some comments or questions into the chat box, and I can always review them at the end if there's anything that might be challenging or if you're not understanding something. All right, so as we mentioned, we have 8 sensory systems, and we're just going to go through them a little bit more in detail, and I'll talk about the small cup or the bucket versus big bucket and what that might look like for that sensory system. So vision, so in our eyes we have special sensors or receptors that help us see, and they're located in the back of the eye, and they help us understand things like colors and shapes and how far something is. So if a child has a small cup or a small bucket, they'll be very sensitive to visual information. So they'll get very overwhelmed in busy environments, or if it's a room that's very lightly lit. Okay, so shopping centers and classrooms can be quite overwhelming for these kids. They might be bothered by flickering lights or fast moving visuals like a TV or video games. And then on the contrary, for kids that have big buckets, they might not notice visual information or facial expressions right in front of them. And they might seek out fast or spinning visuals. So they might enjoy watching things like ceiling fans or flipping through books quickly or flipping the light switch on and off. So they might seek more visual information to help fill those buckets. All right, the next system that we'll be talking about is the hearing system, so our auditory system. If you look at the little blue shaped apparatus in the picture, you will see that there's like a snail-like shape. So that is our hearing section. Okay, so that's where all our sound is processed, and that's called the cochlea. This is where we process things like sound pitch, volume, and where the direction of sound is coming from. So for a child that has a small cup or a small bucket, that means that can be quite sensitive to auditory information. So we'll notice this in kids that cover their ears or they get very upset with everyday noises. So perhaps hand dryers will be challenging for them, vacuum cleaners, or loud or sudden voices. They might really struggle with that. I've seen in kindy environments, particularly during music, when there's musical instruments, they might not enjoy that. Or when there's group sort of singing sessions, they tend to sort of shy away or sit towards the perimeter of the classroom. These kids also struggle to focus in noisy environments like classrooms, or if it's a birthday party. They find the noise quite overwhelming. And then kids that have large buckets, they need more auditory information. So we'll notice these kids don't always respond to when their name is being called, especially in a busy environment. So for example, it might be in a shopping center or in a classroom. You might have to constantly call their name repeatedly to try and get their attention. These kids will also seem to enjoy making loud noises. So they'll often turn the television up really high, or they might make lots of noise themselves, and maybe they'll bring out musical instruments and they just love making a big noise. All right, let's talk about the next sense. So our tactile sense, this is our receptors are located on the dermis and epidermis layers of the skin, so just within the skin. And it processes information like touch, also if it's a bit of pressure, the texture of objects, temperature, and pain. So for some kids that are over-responsive or sensitive to touch, so remember they have the small buckets, they might avoid certain clothing. So these kids really struggle with things like tags in their clothing. Socks are always tricky. Sometimes underwear. I've got a couple of kids that struggle with wearing underwear. Tight wristbands, even clothing that creases on their skin is quite distressing for them. So I've had previously a little girl that really struggled with going to gymnastics because she had to wear tights for gymnastics, and often would gather, tights would gather behind the knee. And this was really, really challenging for her. Or even seams under the armpits. So these kids really struggle with anything where there's any sort of additional pressure being put on the skin. And they notice that. And a lot of us don't even notice that we have a tag in our clothing. They might also react quite strongly to light touch or unexpected touch. So like I mentioned previously with the little child that struggled with a peer brushing past them, they will really struggle with that. Things like hair washing, going for haircuts, is so challenging for these little ones. Having their nails cut is another one that they typically struggle with. If they are under responsive, so they need more information of tactile, they have big buckets, they don't seem to notice when they get dirty or wet, they constantly have food on their face, you'll have water play and they'll be in the water, you'll have sand play and they'll be in the sand, they won't even notice they've got sand in their hair and their ears, they just need more and more and more of that input. They seek out lots of extra touch, so they might constantly touch things, touch the educators, touch their peers, stand in the line, keep touching their friends when they're saying the line, roughhousing with their peers. So these kids can be very, very tactile seeking, and they might look like kids that are just trying to agitate others, but actually they're just seeking out more sensory information. All right, the gustatory section. So this is our taste. So our receptors are located on our tongue, or our taste buds are on our tongue, and it processes taste sensations. So is something sweet or bitter. So for a child that is sensitive to taste, they might be very picky eaters. They might avoid certain flavors or temperatures of foods. And oftentimes we might see that these kids also have difficulty with tactile information, so touch. So they might struggle with food textures, for example, inside their mouth. These kids often gag or refuse to try new foods or unfamiliar foods, so they tend to stick to their safe foods. They're quite picky eaters, and they really struggle with trying new foods. They might even prefer to only eat a certain type or certain brand of food. For our kids that have big buckets for taste, they will crave strong flavors like salty foods or spicy foods or sour foods, so anything that's got strong flavor. And they might even put non-food items in their mouths, so things like toys or clothing, and that's to seek out extra oral input. And we'll cover this a little bit more in the proprioceptive system, so they might also be seeking a bit of that heavy work, kids especially that are chewing a lot of non-food items, showing that they have quite a big bucket for this. All right, the olfactory section, so this is smell. So these receptors are located in the olfactory epithelium of the nasal cavity, and it processes smell information. So if a child has a small cup, their cup can be quite sensitive to smell. So they will have quite big, strong reactions to everyday smells like perfumes or cleaning products or certain foods. I had a child that was actually chewing on his clothing, and he never previously had chewed on his clothing. And I was able to ask him, why has he started chewing on his clothing? He had just started prep, so I thought, it's possibly just anxiety. He's not transitioning into new school. And he said that he just wants to taste what it smells like. And when I mentioned this to his mum, she said, oh my gosh, I've just been to Costco and I've bought those scented beads, and she's just started using that in her wash. And he was quite sensitive to the smell. So it's really interesting with our kids that have quite sensitive smell, that they can pick up smells that not even, we would even notice. These children may also feel sick or refuse to enter places that have strong odors. So, for example, bathrooms, public bathrooms, they might not want to go to the bathroom. And, if you didn't think any otherwise, you might say that the child is anxious or doesn't know how to toilet, but meanwhile it's because of the smell in those bathrooms. These kids also struggle during meal times at schools as well. So everybody will open up their lunchbox to eat, and these little kids will want to run away during lunchtime because the smell is just too strong. For our kids that have large buckets, so they need more of that smell input, they don't seem to notice strong smells or unpleasant smells that others may react to, and they might even seek out smells. So these kids might sniff people or objects or food more than what would be typical. All right, the vestibular sense. I think this is for me the most interesting sense, and I feel that a lot of our children experience challenges with this. So if you look at the structure again on the right, we'll look at the picture on the bottom. You can see that Snell figure, that was the auditory sense. And then next to that, you can see the little bony structure where it's got those three, they're called semicircular canals. That's our vestibular system. And inside there, there's little hair cells and fluid. So when we tilt our head in different directions, the fluid moves and it activates those little hair cells and tells us what our body or what the position of our head is doing. So it is responsible for or processes information that's related to balance. So it tells us, if we trip and we, there's a change in position of our head, it will tell us, oh, you need to put that leg out, adjust that muscle, do this to stop you from falling. Postural control, so for a child that has that's sitting still, so once we're not moving, our vestibular sense will tell our body, oh, you're not moving, turn on those muscles that help us sit up nice and straight, that helps keep our spine aligned. It also helps us with movement, so being able to understand which way our body's going. So it's essentially like an internal GPS system. So for kids that have small cups, they might be afraid of swinging or sliding or going or climbing or going up high. They might avoid playgrounds, or they get dizzy quite easily. Okay, so they're quite sensitive to movement. They might get upset or anxious with fast or unexpected movements. So if they're being picked up quickly or spun around, they really struggle with this. Even walking on uneven surfaces, you'll see that they'll be quite low to the ground. They'll be a little bit cautious when they're trying to do a little obstacle course or anything that involves them moving slightly higher off the ground or requiring a little bit of balance, they will struggle with. For our kids that have large buckets, so you can imagine these are our on-the-go kids. So our kids that are constantly jumping and spinning and rocking and running and jumping and needing to go higher and faster. They love movement and they will seek out intense movements. So crashing, they can be quite boisterous with their friends. They love hanging upside down. So you can see there's quite a big country with these, with the vestibular sense. The next one is body awareness or our proprioceptive sense. So these receptors are located in our muscles and our joints and our tendons in the body, and it helps us understand where our body is in space and how our muscles are moving. So instead of having to look at our feet while we're moving, our proprioceptive receptors are saying to our brain, this is where your foot is, this is how it is placed. If you touch your finger to your nose, you can't actually see your nose, but you know your nose is there because you've got good body awareness. So children might appear more clumsy or uncoordinated if they have difficulty with these receptors. They might bump into things or trip frequently, or they might even have difficulty grading their force. Okay, so they might throw things to, they'll be throwing a ball at you, and instead of throwing it at you, they'll almost throw it straight through you. They might seek out rough play. So these kids are quite rough and tumble with their friends. They love having tight hugs, pushing into furniture and walls, climbing into tight spaces. So these are kids that seek out more of that proprioceptive input. Interoception. So our body has quite special senses that are located inside our organs, like the stomach and the bladder and the heart. This sensory system is still quite newly researched, but there's lots of interesting things that are coming out these days. So these receptors help us understand sensations from inside our body. So are we hungry? Are we thirsty? Is there pain? Are there temperature changes? And it tells us, for example, when we need food or when we need water, just to help protect our bodies and sort of please those internal sensations. All right, so let's have a quick look at the impact of sensory processing on social skills. So as you can imagine, a child that might have a very big bucket might not respond to social cues, okay, because they'll need intense sensory information for them to understand social cues from their friends. So they might not be paying attention or might not be getting enough visual information for them to see that their friends are possibly not interested in what they're saying. For example, they might need more proprioceptive input, so they might be quite rough and tumble with their friends, which will impact their relationships with their peers. They might not want to play with them. They might have difficulty, or they might have a small cup when it comes to vestibular processing. So maybe they're a bit fearful of movement and can't join them on the jungle gym. So you can see how sensory processing can impact social skills. For a child that has a small cup, they might avoid group activities or crowded places because of the noise. These kids tend to also withdraw from group play. They're often in that fright response. So they have big difficulty engaging with others. Emotional development. So we know when a child has trouble with processing sensory information, it might make them feel quite overwhelmed, which often leads to stress and anxiety. So for example, loud noise or a bright light or certain textures can be too much for them, and they'll become very, very upset and anxious. And because their brain is struggling to process all that sensory information, they might find it hard to stay calm and control their emotions. So children with sensory processing difficulties may also have trouble understanding how they're feeling inside, so understanding whether they are hungry or whether they're tired or whether they are stressed. And without that awareness, it can be hard for them to manage their emotions and cope with difficult situations. Some other challenges that we might see is hyperactivity or distractibility. So they might have difficulty with sitting still and concentrating. They'll be constantly moving about, and they'll have difficulty shutting out noise and light and touch. So these kids can look quite distractible and can be quite distracting to other peers in their classroom as well. Muscle tone and coordination difficulties. So as you mentioned, these kids might have poor postural tone. They might have difficulty sitting upright at their table. They'll be constantly leaning on their peers when they're sitting on the mat. They could be quite clumsy. And how we mentioned with developmental coordination disorder, they might be have difficulty learning how to do motor tasks, so handwriting or learning to ride a bike, or difficulty learning how to do playing a sport or doing PE lessons. They might have difficulty with behavior. So these kids are easily upset. They can be quite fussy. They might have difficulty being with other people and often are sensitive to change. Speech and language delays. So they might have difficulty with communication and social interaction. They might miss those nonverbal cues because of their big cup. So they're not being able to pick up on those nonverbal cues. They might have impacted attention, which might impact, difficulty with decoding intentions or social reciprocity, and adherence to social norms. These kids might also have some learning challenges because they have executive function deficits, so difficulty with attending. They might have difficulty with reading or spelling or writing, and can often avoid learning tasks. So just a few strategies: predictable routines, calm down stress spaces, and having sensory strategies put in place can help improve emotional regulation by providing a sense of security and control for these kiddies. When routines are predictable, then children know what to expect. It reduces that anxiety and stress. So calm down spaces can offer a quiet space where children can go to when they feel overwhelmed, and this can also help them manage and control their emotions. When we provide, as therapists, when we provide sensory strategies, things like deep breaths and sensory breaks, so providing maybe some heavy work or some controlled movement breaks, can also help with that overload and making it easier for them to regulate and stay calm. But I just love this quote by Dr. Ross Green, and it says that kids will do well if they can. So kids aren't behavioral for no reason. And it's really important that we are looking at those underlying factors that could be impacting their regulation, could be impacting their learning, or, the reasons why they are, moving away from a learning environment or not focusing. So it's important that we investigate that first before we label them as behavioral children. So I thought I'd just give a little bit of insight around if you feel that you have a child in your class, or if you feel your child needs OT or needs an assessment with sensory processing, you can get in touch with an occupational therapist. And I would suggest trying to find a therapist that is trained in sensory integration. You could discuss your concerns with your GP or a pediatrician. You might be eligible for a Medicare rebate, which is called a chronic disease management plan. You don't need a referral to go to occupational therapy, but if you would like Medicare rebates, you could just chat to your GP to see if your child will be eligible for that. And you may even be eligible for NDIS under the early intervention schemes. So having a chat to the Benevolent Society, children have access to funding which will help support and pay for those therapies. All right. Thanks for listening. I know that was a bit content heavy. If anybody has any questions, I'd love to answer those for you. Feel free to unmute yourself if you need to ask a question. Otherwise, you can pop it into the comment, into the chat.
Is it possible for a kid to have a big bucket for one sense and a small bucket for another?
Yes, absolutely. So we find this quite often. So for example, I think about a little child that I did a questionnaire on yesterday. So this child is quite sensitive to touch, but is a big movement seeker. So has a very, very small bucket for tactile input, but is a very busy and constantly on the go and lots of running and lots of jumping. So yes, we do. We will often find that, especially for proprioception, mostly they have big buckets for that, because a lot of kids use proprioception as regulation as well. So yeah, we'll often have mixed buckets, and sometimes it also depends on the child's ability to regulate. So if a child is feeling more overwhelmed at certain times, they might even be more sensitive. You know how we said at the end of the day, we might be more touched out, or we might have difficulty with auditory information. Yeah, but you definitely find kids that have big and small for one or the other.
And next question from Lauren. Aside from removing the child from the situation or removing the stimulus, what sensory tools are effective at managing overstimulation?
Yeah, and that's an interesting question. And I guess it depends on which sense we're talking about, right? So if we are, for example, talking about a child that might have difficulty with tactile information, for example, we always err on the side of caution. So with especially the tactile sense, but we might remove tags from the clothing, or we might purchase clothing that doesn't have lots of seams, for example, or washing clothing quite a few times before the child wears it so that it softens the fabric. So it depends on which sense we're talking about. It could be, for example, a child that has difficulty with processing auditory information. So a lot of kids that have this difficulty are able to tolerate it better when they're in control. So if you're at home and you need to vacuum, I might say to the child, I need to vacuum, would you like to turn the vacuum cleaner on? Or I might say to them, I'm going to be vacuuming, would you like to wear a pair of headphones while I'm vacuuming? So I'll always consult with the occupational therapist on advice on how to support these kids. But there could be, yes, various ways depending on which sensory sense that we're talking about. The goal
Next.
one last thing. The goal is not to remove the child from the situation. We do want our kids to be engaged, and we want our kids to be part of learning and be part of the group. So it really is about how do we support the child to be in that environment with their peers.
Yep. Next question from Inlandy. What do you think about color monster strategies for social emotional regulation?
Yeah, the Color Monster book is beautiful, and I use it actually in my Kindy Uplift programs as well. And I think it's a really great way to help support kids, yeah, understanding emotional regulation and being able to sort of put them into certain categories. I think that's what you're talking about, the Color Monster book. And yeah, there's some beautiful learning tools in the book, the Color Monster, and there's lovely ways that you can incorporate that into learning if you are teaching, for example, a class or your child.
Next question from Audrey. Is there a certain age when we could ask a child for a diagnosis that he or she has a problem with sensory processing?
Yeah, no. So I always say the earlier the better. I've had young children come and see me, as young as 1, and it's not necessarily a diagnosis. Like I mentioned in the slides, it's not actually diagnosed in Australia. It is in other countries. We just use a diagnostic manual that doesn't identify it as a standalone diagnosis. But we do know that it is part of the diagnostic process, for example, with autism. So one of the diagnostic criteria for autism is having sensory challenges. But there's no certain age. So if you do feel that there's a child that has difficulty with processing sensory information, and particularly if sensory inputs are preventing the child from learning or from managing their emotions or making friends, then I definitely feel that the sooner the child gets support, the better. Because essentially what we want is for the child to be included in all the environments. We don't want them to feel excluded, and we want to make sure that they feel understood as well, because that's a big aspect of sensory processing, is being able to understand what the child's going through and validate their feelings, because it's not an external disability. We can't see it, and a lot of our kids feel misunderstood. So it's really important, yeah, as soon as you feel that there could possibly be something going on for the child, seek support for the child so they and you can feel more equipped to deal with those that sensory information. So children give obvious or subtle cues on what is affecting them sensorily. Is there a general checklist of these cues to look for in all the areas? You might be able to find some if you search for it. I could also perhaps share a copy with Karthik, one that I've created myself, and it goes to all the different areas. So I'm happy to share that with you, Karthik, if you want to share it amongst the participants. Otherwise, you're more than welcome to get in touch with me and I can share that with you as well.
Sure, that'll be fantastic.
Awesome. Okay, from Rogi, what is the most effective way to teach a child about colors, given the fact that the child is bilingual, where the child speaks Spanish often at home? So Rogi, I think this would be a speech question for a speech pathologist. I would, yeah, it's tricky to say, but as an OT, I would just, I'll probably present it in both ways. So I might first say it in Spanish and then I'll give it the English word. And I think repetition is important here, and using it in everyday scenarios, you know, look at the green leaves and look at the blue sky, and continuously talking about colors to the child so that they can pick up on those cues, and play games with color matching games and, you know, identifying colors. So can you find the blue circle? Can you find the green circle? So I think it's more about repetition, and I would definitely speak to your speech pathologist if you feel that there could possibly be a delay in language. And then another question, if they have proprioception and vestibular issues with OT sessions, are they reversible or fixable, or will we just learn how to manage? So there's definitely ways to improve. So a child that is born with sensory processing difficulties is likely to have sensory processing difficulties throughout life, but the way that they manage those sensory processing difficulties is what really matters, right? So, but particularly with vestibular, we can definitely improve functioning in the vestibular system as well as the proprioceptive system. Okay, so improve body awareness and movement and balance. We can definitely improve on that. So it depends, again, if the child is under responsive. I've had many kids. My one particular highlight case that I love to talk about was a little boy that I started seeing when he was 4. And the challenge that he was having was not being able to go onto the jungle gym with his friends. Okay, so at their kindy, they had a big ship, but on the ship they had a bit of a wobble bridge. So he could never get from one side of the jungle gym to the other because the wobble bridge was too unsteady for him. So he had a very, very small cup for his vestibular sense, and therefore he felt quite insecure walking across the bridge. And my goal was for him to be able to walk across the bridge, to be able to play with his peers, and he did that. So by the end of the year, he was confidently, he could jump across, he could walk across, and he was doing it confidently. So yes, we can definitely help improve it, their processing. This little boy is the same boy that refused to go to swimming lessons, hated going under the water because he lost his whole body awareness. You can imagine, you know, having that sense of gravity removed. He really struggled with that sensation of not being able to be in control, where I eventually had to work with the swimming teacher to work on having some visuals for him, because then he just constantly was under the water. He wasn't actually following the instructions. He would constantly want to be underwater. So yeah, definitely, we can definitely help improve sensory processing. Highly sensitive to haircuts, what to do? Exposure as much as possible, or just don't do it for a while? So like I mentioned, Claire, before, is that with haircuts, with the tactile sense, we have to tread carefully, okay, because we can cause trauma when it comes to tactile information. So I wouldn't expose if the child is feeling quite distressed by haircuts. Exposure is not going to help. So we don't desensitize a child that has tactile sensitivity or has a small cup to touch sense. What we might do is to help improve the child's ability to feel in control. So we might suggest having haircuts in front of the mirror. We might have him perhaps cut hair from a doll, for example, to help sort of get him used to haircuts. Some other strategies would be, for example, providing deep pressure, so that proprioceptive sense that can sometimes inhibit that firing of the tactile senses that cause that sensitivity. So a nice head massage prior to doing haircuts. Doing a social story is another great one. So reading about a social story about the child going to have a haircut. So there are various strategies that we can use to support haircuts. But yes, haircuts can be really tricky for our kids that do have tactile sensitivity. All right, we might have enough time for 1 or 2 more questions. But like I mentioned, if I don't get to all the questions, you're welcome to get in touch with me via my email address. Otherwise, yeah, we can communicate through Karthik as well. Okay, what's the best way to handle big bucket children? I love how you're referring to big and small buckets. I think it's such a lovely way to understand and remember what that information means. Handle a big bucket child to be able to get them to concentrate or respond better, especially those who don't realize the dangers around while moving or playing. Yes, and these kids are tricky. A big movement kid is, I'm assuming you're talking about our movement, our vestibular sense when it comes to moving around. So there's a few things. The first one is understanding that there's certain movements that are calming and there's certain movements that are alerting. Okay, so calming movements is if linear movements, anything that's forwards and backwards, and disorganizing or alerting movement is movement that is erratic or that is like spinning, for example. You can imagine that being more alerting versus just sitting on a swing and swinging backwards and forwards. So I would try and encourage the child to engage in movement activities where it's forwards and backwards movement. So this might be going on the swing before having to sit down and doing morning ring, or sit down and engaging in a learning task. I might try and provide safe opportunities. So I know you said they have difficulty understanding the dangers when moving or playing. So sometimes I know these kids can be quite risk takers, where they often want to climb higher and jump off quite high, objects and places. So being able to do that in a safe environment. So perhaps you could have a mini trampoline or a big crash mat. So this is like a duvet cover filled with pillows, for example, or foam, so that they're able to jump and move and still feel safe. But I think it sounds like there's a lot of other things happening for this little guy. So I might even just say, get in touch with an OT, because if it's going to impact safety, I think there's something more that we might need to address other than just putting in little strategies. Thanks, Travis. Thank you. Oh, thanks, Claire. It was so lovely speaking to you all this evening, and I hope that was informative. And yeah, if you have any questions, feel free to pop me an email. Yeah, thank you.
Thank you, Kate. It was a very, very informative evening. Thanks a lot.
Thank you very much. And thanks everybody for coming again.
Thanks, Kate.